ISHRS, the International Society of Hair Restoration Surgery, is an organization of physicians and medical assistants that focuses in the disseminating information to physicians and medical assistants about contemporary technologies in hair restoration surgery. The primary function of the organization is to educate, to train, open communication, education, and training. We accomplish those things through an annual meeting which takes place at different locations around the world. And over the last few years we've actually developed or been privileged to affiliate with physicians from around the world who wanted to develop local, smaller, regional workshops that make it possible for smaller groups of physicians to get into the operating room and see things closer. And these workshops generally have specialty topics. So we've had workshops in Japan, we've had workshops in Israel, we've had workshops in Poland, and we've had workshops in Florida. So many regional workshops. And this workshop with Dr. Polosinski, which is going to specialize in discussing issues around female pattern hair loss and how to treat and diagnose and manage these complex patients.
Is that androgenetic alopecia in women is a very similar condition to men. And in men, we see perhaps 5% of our men have a androgenetic alopecia in a female pattern, where with retained hairline. So we see a significant number of patients with that pattern over time. So it doesn't surprise me to think that it's just part of the varied presentations of hair loss, that in women, because they have more estrogen and they have a different hormonal environment, that they don't exhibit exactly the same clinical signs of male pattern hair loss, except interestingly in the women who are perimenopausal. And as their estrogen declines, then we see a more common presentation of the Norwood style temporal recession in perimenopausal women, which I think is definitive evidence that there is an effect of the estrogen on women, which gives them a different clinical presentation in their premenopausal state compared to the menopausal state. I don't know that there is an increasing incidence of pattern hair loss in women, although some people have argued that the widespread use of oral contraceptives with androgenic-like progestogens in them, which were the initial phase of pills that came out, had higher levels of progestogens that were androgenic, and the more recent pills seem to be less androgenic with their progestogens. That may have had an impact perhaps on the frequency of presentation of female hair loss. I think that certainly I see a lot more women in my practice now, and I operate on a lot more women in my practice now than we did once upon a time. I think as was the move towards the tiny grafts, the follicular grafts, has made women a more attractive surgical candidate, because you can get in between the more diffuse thinning that you see in androgenic alopecia. So I believe that they are a much more surgically attractive patient. It's approximately 15% of my caseload now, which means that I'm treating a lot of women. I think that the medical treatment of androgenic alopecia in the practice is complicated. It's far more complicated than in men. I personally believe that 5-alpha reductase and dihydrotestosterone are very important, as is the level of aromatase activity in women, which defines a lot of their presentations and their success for treatment. And I think that even though it's not really an accepted treatment to use finasteride in women, I suspect that over time more and more physicians will treat women with finasteride, because up until now the major use of cyproterone acetate or spironolactone have not been terribly effective in regrowing hair in women, but they've had a greater success, in my opinion, in stabilisation.
It's been a great honor for me to serve as part of the faculty in this meeting in Poznan. I think it's been a marvelous meeting. There has been live surgery, and people have had an opportunity to have a more intimate relationship with the faculty so that they can ask questions at their leisure. There have been marvelous discussions. I think that just being in Poznan has been a wonderful experience. Dr. Kolozinski could not have been a more gracious host. Overall, I think it's one of the best regional meetings that we've ever put on as part of the ISHRS.